Hello, my name is Shantae Williams Stoner, and I will be presenting my research paper, which is on to what extent should the United States federal government provide financial resources, for example, social supplement income, to families whose spouses have been diagnosed with terminal illnesses. So one of the symptoms that come out of cancer is what's called financial toxicity. Some of the statistics that have come out are that reportedly 1,752,735 people have been diagnosed with cancer. Out of those 1.7 million people, 599,589 people have died from cancer. Every 439 new cancer cases, 146 of them have died from cancer. 33 to 80% of cancer survivors exhaust their savings due to medical expenses. About 34% borrow money from family and friends, and the bankruptcy rate is 260% higher for those that have been diagnosed with a cancer diagnosis. Financial toxicity in the United States, cancer is one of the most costliest, expensive treatments to cover. It affects medical and non-medical costs, included but not limited to your transportation, getting to and from the hospital, loss of income, basic household needs. Financial distress has also been recorded as being recognized as an unfortunate but a common event that affects patients with cancer and their families. Cancer patients have devastatingly poorer health outcomes due to financial distress. There are various patient assistance, financial assistance resources that help, but none of them cover the daily household expenses that's needed to survive on a day-to-day basis. You'll have some American Cancer Society, they offer different financial resources that they have, which will cover your transportation, transportation meaning getting to and from your doctor's appointments, but not to help with your overall household expenses, which is where the majority of the stress and the outliers come from when dealing with cancer. So when you have a patient who is dealt that blowing tragic news about having cancer, now starts the clock of how am I going to pay? If I have a copay, if I have an out-of-pocket, will I be strong enough to maintain on this job? If I have to lose my job, what other resources can I have to be able to help me access the things that I need? So when you Medicaid is offered, if you're depending on your age, Medicare is offered. Then there's also having COBRA extended from your job, short-term and long-term disability. But there are so many various different resources to be able to help there. Raising awareness is something that's very important. Raising community awareness around the financial toxicity, having those talks, starting with the day that you are diagnosed and you're having that talk with your doctor face-to-face. It has to be part of the plan of care, being transparent about the cost of how much the treatments will be, as well as the financial screening and what the plan will actually look like. There needs to be some awareness brought into the communities to be able to help stop the bleeding of financial toxicity and help bring back the quality of life for our loved ones that have been given this cancer diagnosis. Thank you.